have closed captioning available, and that transcript will be available after the webinar, along with the recording and all the presentation materials. And at this time, I'll hand it over to David.
Thank you, Jessica. Welcome, everybody. This is another installment of our Community of Practice calls for Iowa, and we're pleased to have some representation from some of our state agencies that will share a little bit of their experience of where they're at and how they got there and where they hope to go. So hopefully this will be an informative and interesting conversation for each of you. We're going to start off with our friends from the Department of Human Services and Medicaid Enterprise Program, and I'm pleased to present LeAnn Moskowitz and Lin Nibbelink. Both LeAnn and Lin have been key participants from day one in Iowa's Employment First efforts, and I know are tireless workers on behalf of our state systems as they look at how we can better serve our individual candidates that we're working with. So LeAnn and Lin, thank you for your work, and I'll turn it over to you.
All right, thanks, Dave. This is Lin Nibbelink. Can you guys hear me fine? Okay, we're just going to start off with a kind of an update on the Medicaid rate redesign work that has been in progress. And do we advance slides, or do you?
I think she'll have to tell her next slide, right?
Next
Jess?
slide, Jess, or do we do what this slide?
Yeah, you can. I'll click it for you, but it's just the little arrows on the left-hand side. But I'll advance your first slide for you.
Okay,
so just
thank
let
you.
me know.
Oh, got it.
Okay, so
okay, we're just having a little technical. There we go.
there we go. Okay, so we are all about changing the question to change the culture. We used to ask, do you want to work? Now the question is, what work do you want to do? So there's change happening all across the nation. Everybody's aware that there are recent findings by the U.S. Department of Justice and the Department of Labor in Oregon, Rhode Island, New Hampshire, and other places. And basically they found that segregated services violate the integration mandate of the ADA and the U.S. Supreme Court's Olmstead ruling on most integrated settings. Excuse me. The Centers for Medicare and Medicaid Services also issued guidance in September of 2011 describing the expectations for pre-voc services when they're offered within sheltered workshops. And then Title 14C, or the subminimum wage standard of the Fair Labor Standards Act, is also under review in U.S. Congress. MHDS redesign work that's been going on requires core service definitions and rules, and the regions are required to do evidence-based practices. And we know that supported employment is an evidence-based practice. So kind of systems change on employment for people with disabilities has been happening for some time. What's brought us to where we are today started way back, probably even previous to 2005. But the MEG, or the Medicaid Infrastructure Grant, had a lot to do with the things that happened in 2005 up through 2012. There were consumer workshops and self-employment workshops. There were, in 2009, Employment First focus groups and an Employment First Summit funded by MEG. In 2009, DHS also joined the State Employment Leadership Network, or SELN. 2010, we received the SELN Findings Report, which was basically a self-assessment of Iowa's system regarding employment for people with disabilities. There were also MEG pilot projects on customized employment at that point in time. 2011 and 2012. 2011 is when IC started, I believe. 2012, SELN researched other states and made recommendations to us, and also produced a capacity building report. And these are the things that we have used as the foundation for the work that we've done over the last year or two. 2012 was a big year. I think that was also the year that Voc Rehab received the Employment First State Leadership Mentor Project grant. and the year that Workforce Development received the Disability Employment Initiative Grant. In 2013, we did the key assumptions document out of the work that Selm did for us and the stakeholder brief, and those were used to kick off the community conversations. Then you guys know that during June of 2013, which is almost a year ago, believe it or not, we had community conversations in 5 places around the state where we sought input from a broad range of stakeholders. We tried to have those located centrally in the 5 different regions of the state so that it was accessible to as many people as possible. This was in collaboration with Folk Rehab, the DD Council, IC, and it was facilitated by Dale Verstegen from Transcend and attended by 152 people. Then from that, we had work group members who auditioned and were selected to represent a balance of rural, urban, suburban, large and small providers, providers who only did facility-based services, providers who only did community-based services, and those who did both. So throughout last summer and fall, this work group was very, very busy. There were 30 participants chosen representing parents, siblings, 14 provider agencies, case management, and county and state funders. We engaged in intense all-day work group meetings twice a month in Ames or Johnston, and people had homework. The first 2 meetings were spent on employment service definitions, and LeAnn's going to talk more about those coming up. The next 2 work group sessions were spent on provider requirements, staff qualifications, and staff training. It's a very integral piece of the model. And then we spent actually parts of or 4 sessions on reimbursement methodologies, talking about fee for service or payment for outcomes and different ways of approaching this. And then we did some feedback webinars in between for people that were not actually part of the work group. So we are working hard to craft systems changes so that individuals have an expanded array of choices for employment and wraparound supports.
Good afternoon, folks. This is Leanne. So as Lynn had talked about, the work group made recommended changes for the service definitions for pre-vocational services, supported employment, and day habilitation. The work group also talked in detail about service provider standards, staff qualifications for those services, as well as what components would be included to derive the reimbursement rate, which would support the quality staff and the quality services that folks expect. So some of the changes that the work group talked about for pre-vocational services is adding an additional service component of career exploration to this service to enable members to have experiences that will help guide their employment choices and employment goals when looking for employment and working on skills that they need to become employed. And so that would be one change within pre-voc. As we know, CMS has indicated that pre-vocational services are to be time limited, so it's likely that a final rule would have some time limits placed on the assessed needs of the members for participation. We also looked at, we would have to have a plan for transition of those members who are maybe participating in pre-vocational services today that don't necessarily have employment goals. So, and then for supported employment, what the main difference will be is that services will be identified as either individual employment services or group employment services with a very similar menu of services that could be provided under either group or individual. And then, of course, there'd be different reimbursement rates based on whether that person was receiving either individual or group employment, or what we call enclave today. So, and with dehabilitation, we want to also expand the definition of dehabilitation to include the component of career exploration too, with the idea that folks never stop asking the question of, do I want to work? And that people, as an expectation for, John Q. Public, that we go to work and we talk about what we want to do for work when we're not working. The same can be said for folks that are, receiving publicly funded benefits. We also will adopt the full definitions for all three of those services that were provided by CMS. And some of you may have already heard me say previously, we were required to do that for habilitation in the most recent state plan amendment approved by the Center for Medicaid and Medicare Services. So when you go out to the DHS website and look at the state plan amendment documents, you will see that we've already adopted those service definitions for the habilitation program, while the actual model remains the same, where we have job development, employer development, and supports to maintain employment, pre-voc and DAHAB as they are today. Those changes have not occurred yet. So, moving on. So this is a sample rate model that was provided to us by our partners at the State Employment Leadership Network. And we walked through this model with the Employment Service Redesign Work Group to go through each component that you see there on those line items. So we talked about employee-related expenses, we talked about mileage costs, talked about what the program support costs were, and then the annualized costs per staff person. When we looked at the actual wages for employees, we looked at a variety of things. We looked at what VR pays today, or the state payment model for VR-type employees. We looked at other states and how they reimburse similar positions within employment services, as well as across their VR systems. We also looked at surveys taken by agency providers to identify what the average wage paid is for like positions across the state. So we looked at a variety of things when looking at wages. When we looked at billable hours, providers told us that the average hours paid per week is about 37.5 for a full-time employee. So that's how we built this model. We looked at how many vacation, sick days, or paid time off combination. Providers arrived at an average about 32 hours or 32 days per full-time employee per year. And then we also had to look at the staff training hours. How many hours would each employee participate in for those given positions? And you can see from this model that for employment training specialist or job coach, there were more training hours because of the advanced certification that's involved in being designated an employment training specialist. And then, of course, the rate paid for those services would be commensurate. So you can see that this is the model that we worked from when trying to derive our assumptions that would be built into a future reimbursement rate. And so what we've done is we've taken this model and we've applied our assumptions about how the number of people who are in pre-voc today will move through the service system to project how many folks that IVRS would be able to serve through job development and into their first 90 days of stabilization through job coaching, and tried to project the movement of people as well as the cost of services over a 5-year period of time. And so we have arrived at a model, and as I said, the rates that we landed on combined the work group average recommendations, and so we looked at what the minimum rate paid today is, maximum rate paid, and the median rate paid today when looking at our rate models as well as the salary levels for the staff that, of course, is a component of any reimbursement methodology. So, as I've said, we looked at a variety of factors when trying to boil down to what would be a target salary for each level. So what we need to do next is we need to continue to work to implement our proposed changes. We also want to keep working with our partners at Sound and the Office of Disability Employment to fine-tune a potential rate model. We know that given the projected Medicaid budget deficit in this year as well as the next couple of years, that we will need to derive a model that is as close to being cost neutral as we can while still trying to achieve the desired impact of expanding that array of services and helping people to get that career exploration experience to identify their personal work goals. So we also intend to keep working with our partners at IVRS. As most of you are aware, I believe it's Section 70 of the House File 2463 directs the department to work with our partner IVRS to align our models and make recommendations to the legislature on a realigned service system for employment services. And so that is work we've been doing for the last few years. We've been traveling on that pathway, and so we think that it will probably become the work group's task to make those recommendations to the legislature. And so there's still work to be done. The work's never done. But we'll continue to cost model out our long-term projections as well. We have other factors that play into this. There's the balancing incentive payment program that's going on, where the state is trying to rebalance services, move away from facility-based type settings to community-based type settings. We also have the HCBS setting rules being finalized, where states will be asked to submit a final transition plan to the Center for Medicaid and Medicare Services. Those setting requirements, those new rules, do impact day programs and pre-vocational type service centers and adult daycare type programs, day services and programming. We are still waiting for CMS to provide us with additional guidance. There's been a lot of public comment and a lot of public feedback about what that really means for employment services and day programming, and CMS has promised that they would provide us with that additional guidance. So we will know how to address those going forward, as well as address it in our state transition plans when we're addressing settings where HCBS services are provided. So we will be reaching out to everyone to help us craft those final transition plans. And the public comment period is open now. If you haven't had the opportunity, you can go out to DHS's website, go to Medicaid, and find the HCBS setting webpage to comment on. So anyway, we're going to take our sample models and keep trying to flush those out and see where we land year 1 through 5. We're also going to draft rules again and invite our comments from our partners, the public, as well as the consumer advocacy community. The rules process is a 6-month process. If you're not aware, from the date that we submit it to the rules editor, it must go through the DHS Administrative Rules Committee a number of times, as well as through public comment, tribal comment, CMS review period. And so it's about a 6-month period total. but we do hope to get to the point where we have rules for submission, hopefully later this year as we get to reconvene the work group. So what you can do, you want to get involved, join the Coalition for Integrated Employment. If you're on this call, chances are you already have. Yay. Explore how your agency can be part of system redesign. There are more and more tools and resources being made available all the time to providers who want help with designing their services for the future and starting to address some of those transition issues that will be inevitable in the service delivery system. There's a number of providers that are already working with professionals who have prior experience in helping to redesign their own employment services. And so reach out to the Iowa Association of Community Providers or the Iowa Coalition for Integrated Employment, and they can steer you in the right direction and get you connected to the folks who can help you. And then, keep talking to us. Keep telling us what you're worried about. Keep telling us, what your concerns are. We know there's a big concern about the ability to staff up for smaller, more integrated environments, and we understand that, and I think we're all going to have to work together on how we can address those concerns as well as others as we go. So, and keep reaching out. We'd like to hear those good ideas, and tell us what you think. So with that, I think we're done. Let me see if I can contact. Yeah, here's our contact information. Here's the DHS employment website. All the documents from the work group are posted out there on the employment website. You also have IVRS's website, of course, a lot of wonderful tools, a lot of training tools that can be used with your staff to help educate them about different employment strategies, as well as ODEP has a wealth of information as well. And then you have Lynn and my contact information. If you have questions or comments or just want to reach out and tell us how much you like it or how much you hate it, that's okay too. We want to hear from everybody. And I think that's it.
Thank you, Lynn and LeAnn. I think you can tell that the conversation's still occurring behind the scenes, and I think it's important for all of our participants to recognize that conversation's occurring. Sometimes results don't happen quite as quickly as we want, but the questions and the efforts are still going on behind the scenes. And I think you can tell from what LeAnn and Lynn said that there's a real importance on how we address integrated employment, how we explore career exploration, and how we continue to try to maintain a state system that is basically cost neutral. So there's some tough issues that we're still working towards and working behind, but thank you for sharing the information. We're going to transition over now to Lee Ann Russo. LeAnn's our Community Resource Manager for Vocational Rehabilitation, has been involved in a number of efforts across systems trying to address many of these issues, and she's just going to share some highlights about the work that she's been involved with through the VR agency. So LeAnn, we'll turn it over to you.
Okay. Thank you. I'm coming to you live from Dave Mitchell's very messy office today, but anyway, I'm going to try and concentrate on changes that have occurred throughout the past couple of years. Dave's starting his 4th year as Voc Rehab's administrator now, so under his administration, we've seen a variety of changes, most of which significantly include the employment first philosophy and those concepts. So, of course, with today's topic for change, I want to just throw out some mottos that people have established related to change. Woodrow Wilson said, if you want to make enemies, just try and change something. So I don't think in our visits across the state enemies have been made, but I think that's because our efforts have been transparent and we've tried to really encourage partnerships and collaboration. The General Eric Shinesky, the current VA secretary that's under fire right now, said, if you don't like change, you're going to like irrelevance even more, irrelevance even more. So I try and keep that in mind going through, because we don't want to outdate ourselves. We want to be proactive. We want to be responsive. And we need to be creative and innovative as a state system. So that's what we're trying to achieve. Plus, my mother always said, it's never too late to try and do better. So I heard that growing up, along with a variety of other things. Anyway, YVR is changing. Jess? There. Okay.
Got it, sorry.
Come on, wake up. The leadership has changed. I mentioned that, and really we have come a long way, and we recognize the fact that we can't do it alone. So we have to stand together. We need to work together because we're all in this together. So Dave brought the concept of employment first to Iowa. He's set the tone for change. He's embraced the concept of employment first and changed our system so that you're no longer going to hear voc rehab say, oh, you're too disabled to work, or we've done away with the denial letters too. I'll mention that a bit later as we talk about further changes in our system. But really, the efforts that have been made with this administration all lend themselves to ongoing collaborative efforts. So Dave's leadership, I'll just say what John Maxwell says, because I think about Dave when I read this statement. A good leader is a person who takes a little more than his share of the blame and a little less than his share of the credit. So Dave's not in it for the glory, believe me, but he does recognize that we need to change and we need to be responsive to individuals that we're all privileged to serve. So he's changing our system. As we expand our capacity, we have to rely on our partners for help, because, again, we can't do it alone. And hopefully we'll be able to help our partners, the community rehab programs and other community partners that work towards helping individuals with disabilities get to work. Hopefully we can help you meet your capacity too. So we're trying to hammer out some different processes within our system that's going to assist in those efforts. You know, Lynn and Leanne talked about the 80-20 disconnect in the forum meetings that occurred last summer, because 80% of the state dollars were going into segregated types of settings, whereas only 20% roughly was going towards integrated types of employment initiatives. So we want to rebalance that. It's going to be a win-win for everybody. With that, the expectations about work have changed. In other words, you know that, as Lynn mentioned, the question isn't, do you want to work? It's what kind of work do you want to do? So we're trying to meet the employment first philosophy within our system, and we're still trying to figure it all out. You know, we've learned a lot from the pilots, but it's still a work in progress. The pilots included Hope Haven, Van Buren Job Opportunities, Candeo, Cass, Nishna, Story County Community Life, and NIVIC. So we've appreciated the efforts that those entities have brought to the voc rehab system to open our eyes and really help us discover that individuals can and should have the opportunities to work. So that's what we're all about. The 5 public meetings that Lynn and Leanne talked about were in conjunction with both IC and voc rehab. We attended each of those meetings last summer, so we learned a lot of rich information, as Amy would say, Amy Dessenberg. Voc Rehab also traveled out to 12 areas of the state to meet with our job candidates and also our community partners. So within each of those 12 areas, we just asked 2 questions. One was, what's working at Voc Rehab, and then what's not working. So we heard a lot of information about what is and isn't working, which has helped us develop our state plan goals. So one of the things that we found that really was a lack that we could fill was the benefit planning service. So we've tried to infuse that as part of a service that's offered within voc rehab system. The other thing we heard was that there weren't a lot of work opportunities or options for people that were elderly, which apparently is 55 or older in today's world. So we've tried to kind of reconfigure and revisit some state plan goals. The other goals that we have relate to community rehabilitation programs, supported employment, and of course increasing our outcomes. The other thing that we heard from the job candidates specifically were that they really liked the skilled training options that became available under Voc Rehab system when a CRP wanted to offer that service. So those are services, the D11 training that many CRPs are offering, 12 now. We just approved Goodwill of Central Iowa's Ready training program that's going to launch in Marshalltown June 2nd. So these are really program options that have proven to be very beneficial for both the job candidate and Voc Rehab as a funder in collaboration with our community rehab partners who are providing a job coach or trainer or instructor to provide these trainings. So we have several different options throughout the state, and really this is the way that we like to spend our money because the outcomes within the actual skill training programs are very good. So Voc Rehab wants to be a resource across the state. We want to make tools available to you. We've got tools about discovery. LeAnn mentioned those on our website. There are webinars, there are subject matter expert papers, and other types of trainings that are available. And we're going to broaden that to include more customized employment strategies in a Polycom that's going to be offered June 25th. So we do like these types of initiatives. We like to be a resource to providers and provide tools that are tangible that help us meet our needs too. Some of the goals within our system have not changed. Of course, we want to continue to have a flexible system that's driven by a job candidate. So Voc Rehab's mission and vision is making a positive difference for every person, one person at a time. And so that remains our policy or the umbrella under which we operate here. It's not a cookie-cutter approach. It's services that are unique to each individual that applies for Voc Rehab. We want to have the equitable reimbursement system continue for providers that are providing services we've requested and that our job candidates need. So we know that the providers that we work with all need communication, information, and support on an ongoing basis from Voc Rehab, and we're committed to provide that to you. The statewide system is continuing to be refined and tweaked, as LeAnn mentioned. You've heard us say that we want to mirror the rates that other state agencies are paying for the exact same service, so we're still committed to that, but we want to make sure too that there are core services, that they have the same definitions, that the same expectations, so we're all on board, and services are delivered in a consistent manner across the state, so you can go from one area of the state to another and have the same expectations in terms of services that Voc Rehab is funding or providing. Let's see, we want to collaborate and communicate. We really, again, contend that we can expand our capacity through partnerships, and the employment network opportunities under Partnership Plus, the Ticket to Work program is a good example. We've got 6 current employment networks that include NIVIC's JobLink, Workforce Development, Cedar Rapids, Frank Viveris, Goodwill of the Great Plains Prairie in Sioux City, and we just had 2 new employment networks come on board, Square One in this area, and Employment for Everyone in the Dubuque area. So we appreciate those partnerships. It allows us to provide ongoing benefits planning services to each job candidate who is a beneficiary of Social Security. And we appreciate you stepping up. I think that's going to be another push that we can help with under the Partnership Plus initiative. We also have 3 project search programs going. Easter Seals is providing services at Mercy with Des Moines Schools and Voc Rehab, Candeo at Unity Point, NIVIC in Mason City, and we just are starting the conversation with St. Luke's in Cedar Rapids. So that hospital just said, yes, you can have a project search here. So now we're pursuing that and exploring that with the Voc Rehab supervisor in that area. So again, we appreciate these training options because they really have yielded good results and outcomes within our system. We have 7 retail employment with disabilities initiatives. Those are the READY training programs under which Walgreens training occurs. And I mentioned that Goodwill just is starting a program in Marshalltown. They've already established one in Ankeny. Candeo has one in West Des Moines. And Exceptional Persons out of Waterloo has one there. Goodwill of Northeast Iowa had a READY program there as well. Van Buren Job Opportunities out of Burlington has one, and Goodwill of the Heartland has one in both Iowa City and Cedar Rapids. So these are programs that have proven to be very successful and can be replicated across the state very easily. The other changes within our system have included discovery, which is an option that's available now under a standardized payment that was derived from the 7 pilot projects averages. Everyone who's offering discovery, of the 44 partners that Voc Rehab currently has, a little bit over 30 are offering discovery now. And this is a service that's available for a job candidate who needs it. Not everybody gets it because they don't all need it. So again, the unique service is designed to meet the needs of each individual. It's available to help an individual determine their conditions, the interests, and the contributions that they make. So I'll talk about that in just a sec. I want to just reiterate that the most important components of the services that Voc Rehab provides or purchases include the timely service provision. In other words, if you refer to Voc Rehab, we have expectations for when we're expected to make that referral eligible. And same way, if Voc Rehab refers to a CRP partner, we need timely services provided on behalf of the job candidate. We need outcomes, and we need ongoing communication. So it's all a two-way street. I guess, no, I'm not there yet, Dave. Okay, I'm on the model for IVRS changes. I talked about the statewide system. We're trying to build on what we've already developed that we found to be workable and beneficial. I guess I did talk about the core services and expectations, definitions, the standardized payment, but I want to reiterate how we're blending and braiding services to get the most bang for our state dollars with DHS, Medicaid, and waiver. We also have the luxury of having technical assistance that's provided by subject matter experts, so that information's on our website and available to you. And anytime I can go out, I can come to your area, I can try and work out any difficulties you may be experiencing related to service provision, relationships, things like that. We want everyone to be on board because this is an exciting train that we're all on together. So I just want to make sure that you know that Voc Rehab is willing to reach out to you, and don't be fearful of asking for help. We've all needed that. The menu-based services, we've revised the forms, we've gotten input from the stakeholders, as I mentioned. We relied on our CRP partners to initially develop what we call the decode services, in addition to helping us with the refine the menu of service manual that is the document that provides any information you may want or have about decode and Voc Rehab services. The bottom line is we want our funding and policies to align with other state agencies, all directed towards integrated employment. So our goal is to remove whatever barriers may be impeding that effort. We're committed to continuing to collaborate with you. As far as services provision, in talking about discovery as one of the 3 elements that we can purchase, again, these decodes don't go in any order. Not everyone gets discovery, and discovery can also be combined with other services. So it's not a standalone service. It's available throughout the process of working with an individual. It can be purchased more than once if we need more answers or different answers than we perhaps got the first time. But it really is used to identify the job candidate's strengths and needs and contributions. It's an in-depth way to really get to know that person in an environment where they're most apt to be themselves. So we want to use it flexibly and be innovative in the manner that we learned from the pilots. I talked a little bit about customized training, but that too is a flexible process, and it really will consist of discovery and job search planning and development and negotiation. So Ashley's going to talk about that. I know I've heard stories from all the CRPs. I remember Jen's from Cass about how they worked customized employment into one job that eventually manifested itself into 3 different positions. So you can see the benefit of using strategies like customized employment and discovery. Plus, the discovery process allows an individual CRP to be paid up front for a discovery service that you've agreed to provide to an IVRS job candidate. So job development services were reconfigured in that same manner. The other changes in forms include what I'd mentioned before related to the denial letters. We're not issuing those anymore. We've tweaked the resource sharing document between IVRS and DHS to make it more user-friendly and identify the payment points and who does what. LeAnn Moskowitz added T and H codes along with Voc Rehab's D codes, so that hopefully will help you along the way. The employment analysis form has been sectioned off into 4 different sections. One relates to discovery, one to assessment, and the other to supported employment. We've just recently developed a process to expedite services because we anticipate more referrals from our partners to Voc Rehab. And so the forms that that are bulleted below that include the application, the health assessment questionnaire, and intake form are located on that website that you see there under forms. If those 3 paperwork documents are provided to Voc Rehab with, of course, the job candidate's permission to refer to us, we can hopefully get everything processed within a week. So, of course, we've got a waiting list for individuals that are not most significantly disabled. That population, the MSD population, can be served right away, but we want to be thoughtful and plan out a process that's going to meet the needs of both the CRP and Voc Rehab, so none of us reach a capacity issue that impedes referrals to or from each respective agency. I just learned recently that Medicaid reimbursement to bill for completing these paperwork documents is allowable. LeAnn Moskowitz, I know, is trying to hammer out details with Magellan and also determine whether or not pre-voc is going to be included, but I think she'll get information out related to how billing can occur under IME services for individuals who are on a waiver. All right, I'm on my last slide. Well, next to last. Okay, in 2013, I'll just give you some statistics. There were 2,185 Iowans that were helped by Voc Rehab into competitive employment, and we know we did not do it alone. So you helped us help them. But anyway, they earned $19.9 million more than was spent on the entire VR program. So I think we can all be proud of that. The individual payments to CRPs are listed there, over $1 million. They go up every year with the exception of 2010, but we anticipate those going up every year. About 400 individuals apply for VR services monthly, and perhaps up to between 500 and 600 may be able to begin receiving our services, but we're serving about 13,000 currently. So, you know, we've got to be careful about our funds, and that's why we've always asked to be able to draw down for the state to match the dollars that would be available for us from our federal partners in our 80-20 match. So this year, of course, we want to extend our thanks to the community partners who, through ICAP, the Iowa Association, helped with that effort. I don't know, Dave may know more than I right now, But anyway, we wanted to thank you for making this a priority, because it will allow us to grow our programs and thus help individuals who need supported employment services or those D11 training services be served. And so we know that the state budget has an impact on the dollars that are available to us, but we don't want our waiting list to increase any more than it has to, because there are so many job candidates who need services that Dave coordinated last October. He said, I know we can improve the employment situation for people with disabilities. Iowans see a problem and we can fix it. As I look around this auditorium, I see that I have many partners in this effort. Let's not leave here today without committing to one another to put a plan in place. Together we can, must, and will significantly increase employment opportunities for people with disabilities. It's the right thing to do for our relatives, for our neighbors, for our business, and for everyone else in our state. And I wish I would have said that, but I do get to live it every day, and I appreciate that, and want you to know that in my mother's honor, I and Voc Rehab will never stop trying to do better. Okay, thank you.
Thank you, Leanne. Leanne is, I would encourage you to contact and discuss with Leanne any issues and concerns you have. What we found out, though, that one of the keys to our success is really the local relationship. So please make sure you're talking with your local VR counselor and your local VR supervisor and form those relationships so that you can begin at the ground level to talk about how that partnership looks like and what's that impacting you. I know Leanne mentioned a little bit about the VR funding, and it really was a collaborative effort across all of our partners as we provided education, information, and advocacy to serve Iowans with disabilities. One of our key intents with that is you heard LeAnn Moskowitz and Lin Nibbelink talk about the importance of our Medicaid changes and the importance to try to maintain some type of cost neutrality. Well, we can now have that conversation with an additional $3.5 million in the looks of how we can blend and braid and leverage those dollars to serve the individuals we're trying to work with. So that's occurring as we talk. I also want to add, as part of our state systems, you heard a little bit about the Iowa Coalition for Integrated Employment and Employment First. I want to make sure to mention the Disability Employment Initiative, the DEI, that's being spearheaded by our Iowa Workforce Development Centers. They've really focused on some pilot projects across the state. Look at integrated resource teams, to look at the need we have for benefits planning, how we partner together to do improved business development and develop some effectiveness working with our business partners, and also bringing in the conversation of financial literacy. Those are happening in the pilot projects, but they're also happening in other workforce centers as we look at some systems change efforts. And Doug Keese has been a primary player with that through the workforce and is on the Employment First team. So I wanted to make sure we mention that as one of our state systems. LeAnn had talked a little bit about customized employment strategies, and I'm pleased to introduce Ashlea Lantz. Ashlea is our employment coordinator for Candeo and has been involved in a number of initiatives across the state, including here in central Iowa, looking at how do we become more effective as we help individuals with disabilities find community integrated employment. And customized employment is one of those strategies. So she's just going to share a little bit of her perspective of what that's meant for Candeo. So Ashlea, I'll turn it over to you.
Excellent. Thank you, David. And as Leanne said, I'm also coming to you live from David's office. As David mentioned, I'm with Candeo. We are a 100% community-based provider that works in Polk County, and just a little shout out to our employment team if they are listening. But since the beginning of the year, our job developers have supported over 29 individuals in obtaining employment, and that's really ties to the components that we've learned with our experience through being one of the 6 pilot projects and utilizing some customization and negotiation strategies when it comes to job development. So I'm very much a visual learner, so you will see that I've used lots of visuals today in hopes to entertain you. But I won't be as entertaining as Leanne, I imagine. So with the traditional approach, I think this is naturally what we see ourselves kind of get stuck into with job development, because this is how you go about and you find a job. So you meet with a job developer and then you look for the job. So you're interested in maybe categories A, B, and C. We find ourselves looking at Career Builder, different job site websites, and then the traditional interview process. Hey, I'm here for an interview, handshake, but then you're competing with the rest of the 75 people who've applied for that one job. And so a lot of times I think where we struggle in finding individuals who have more unique contributions to the workplace is that we have them competing instead of looking at the contributions. So we kind of just get stuck in that back and forth and back and forth. And where we've experienced that at Candeo is, while we have the philosophy that absolutely everybody can work, when we go with this approach, we find that individuals are looking for a job for maybe 2-3 years, where we really have always strived for that customized piece, but really missed the specific tools that we've learned in the last couple of years, or the last year, I guess. Jess, next slide, please. Excellent, thank you. Oh, I didn't know that she flipped a pancake. That's very exciting. All right, so with the customized approach, these are things that really made the difference for us. So it starts with discovery, which we've all heard lots about. We now have the decode with VR to do discovery, but it starts with the person and where am I at my best. So think about that even with your own self. Your children, your best friends, your own employees. Where is someone at their best? And oftentimes we look at customization in any workplace to highlight the best qualities an individual contributes, having the right person on the right seat of the bus. And so a lot of times with the job seekers we have the opportunity to support, it's starting with where are they at their best. And oftentimes I don't think it's in an office when we're questioning them about what they like to do. Rather, it's a conversation with them maybe at their home, with their family members. And instead of question and answer, it's a conversation. So tell me about what you do. Tell me about your son or your daughter. One of the first individuals that we supported through the grant, we ended up spending 3 hours at the individual's house, having basically a pizza party and a conversation about what this individual really love to do. So that might be something, maybe they make breakfast for themselves every morning, but you find that out through that initial interview process, which really isn't even an interview, it's a conversation. And then maybe you find out that they take care of their fish. Well, how do they take care of their fish? It's the exact same time, at the exact moment of the day, the specific measured food. But I just highlighted those things because it's not about necessarily looking at a job description, it's what are the components of this person that really highlight who they are. And it's interviews with the people who know them best as well. So all of that funnels into the employment planning meeting. And even prior to the employment planning meeting, one thing that really sticks out as a difference is you don't even do job development yet. Or as Carrie Griffin likes to call it, listening.
Sorry, Ashley.
That's okay.
We got it taken care of, so go ahead.
Excellent. Thank you. So going back to the discovery piece, you may spend anywhere from 20 to 30 hours just getting to know someone and who they are, but specifically identifying different environments that highlight who they are. It's not just, oh, you like to go to a ball game, let's go to a ball game. You really want to have an effective strategy of what am I looking for, and what drives that is that initial time where you sit down for a couple of hours and you do that smooth listening, as Carrie Griffin calls it, where you really just listen. There's no form that you're filling out. It's just a conversation. That funnels into the employment planning meeting. So you invite individuals who know this person at their best, and this is where things really start to change as well. You use everyone at that employment planning meeting as a warm contact to an employer. So instead of cold calls, instead of filling out the application that you find on CareerBuilder, you're using that team of people to really drive the job development process. And that's where that entire team leaves knowing exactly what job development is going to look like and who you're going to be talking to on the job seeker's behalf. And then the job seeker drives that meeting. Nothing gets written on the large Post-its without their approval. And then that really leads to job development. When they've identified their top 10 employers, you have a warm contact to usually at least half of those individuals or those businesses. And then you have a really clear plan as a job developer, which while you've put in more time on the front end, you really have a more efficient process of job development and purposeful rather than looking at CareerBuilder and saying, I wonder if this job fits, especially with customized. And then the piece that really stuck out to us at Candeo is it's not customized unless you've negotiated the job in some way. So that negotiation piece is really a key component of customized employment. Now that doesn't mean everybody needs customized like LeAnn mentioned, but that's really what makes it customized is you're negotiating with an employer, and that negotiation is so much more open in a warm environment because you have that contact that was pulled from the employment planning meeting. Okay, next slide. Is that me or is that Jess? Okay, that's me. Okay. All right. So with Candeo, to sum this up really quickly, from year 1 to year 2, we had one staff employment specialist who soaked in all of the information about customized employment. So Jenna Scott took in all of the information, had a very small caseload, and then we are using Jenna and her skills and abilities to really provide that own internal TA to our employment team. So we've used the ODEP webinars. We're also looking at our own training manuals and expectations to really support that discovery component, the negotiation, etc. Okay, so I wanted to talk about this really quick. So the tools with customized employment can be used in a variety of ways. It specifically has to happen this way. So a couple of examples is you may be supporting someone. For example, Jenna had worked with a job seeker for a couple of years where there were no job leads because we were going at the competing traditional way. But through discovery, reflecting on that time that she had learned about the job seeker, he actually ended up obtaining employment and meeting the job description, but with some small customization pieces, maybe about the hours or the physical components of the job. So it's possible that you just need that discovery in the middle, or the next example would be the employment planning meeting, where maybe you use the employment planning meeting to get a clearer idea of where this person is going, and you have the warm contact, but then they're also still filling out the application because that's the requirement of the employer, or because the individual does meet the job requirement on CareerBuilder. So you can use it in a variety of ways, but it's taking out the piece where we go to employers and say, hey, are you hiring? Okay, so I know I'll just go over one quick example. This individual, Jim, he works at the Stelter Company, which is a company that works with nonprofits, it's marketing. He came to us with the contact. So he already had the warm contact in the relationship, and even this took 4 months to develop. So the customized component takes longer, but Jim's in a place of employment that really is a career path for him. So he operates a punch press, he prepares paperwork for accounting, he files, and he updates a database for sales staff. So the sales staff are more effective and efficient because Jim has supported the workflow. And he's now even part of the holiday planning committee. He's really worked to build his contributions within the workplace. But that wouldn't have happened without that customization piece and really getting to look at all of the components of the employer. So I will just skip, I think, to our last slide since I know we're running out of time. I just had a few examples, but really these were just all examples of ways that customization can be used, and you can go about it in a lot of different ways. So to wrap things up, customized employment really offers tools to streamline the process, to be more effective and efficient. And while it requires more time on the front end, and it isn't necessarily easier, because when we look at, oh, Career Builder says here, let's apply for this job, and wait until we hear something, where this, with customization, you're talking to the employer before the application is even filled out. In some instances, the application doesn't even get to be filled out because there's been so much prep work and you've already sold the employer. But it really does make a difference. So again, in Jim's case, where he would have been entering into an entry-level position as a recent graduate, because of the contacts he made, the relationship he had, and the customization piece, he's already taking a step forward in his career. So organizational change, just that it happens to all of us. I think we'll always continually be pressured and should pressure ourselves to really enhance our services. So Candeo has really tried to grasp the customization piece, and how do we make that as a part of everything that we do. With funding, we do have to be creative, utilizing the D1 code with VR, but also the D7 and D8, where can you braid and blend funding with waiver, voc rehab, and maybe even your county. But it does require that collaboration and creativity, and also just to ask questions, because the worst thing they can do is say no, right? And then again, training and support. So really, you know, it's hard to just watch the webinars and grasp it. What else can we be doing to support one another as providers in learning the customization piece and being creative in our job development approach?
Thank you, Ashley. That was a lot of information in a quick 60 minutes, and so I appreciate all of the speakers sharing their time and providing some information about kind of a high-level summary and talking points of where we're at today. I think Ashley's comments really get to the core of what we've been talking about, and we really have opportunities to open ourselves up to new ways of problem solving and resolving issues as it relates to employment. And I think Candeo, as well as our other pilot projects that you've heard about in the first couple of community practices, have done a really creative and innovative job in looking at ways to leverage social capital, leverage contacts, and then use those contacts in a different way of service delivery. And there's no one way that works for everybody. You kind of have to find your own way, and each situation's individual. But I think certainly Ashley, and as well as our other projects that have presented in past months, have kind of highlighted that process and hopefully gives us some things to think about. So it really is a different way of providing a service and helping us look at ways that we can be the best, just like our job candidates. Next month, we venture off a little different direction with our community of practice. The first three community practice calls we've had have really focused on hearing from people in Iowa. Starting next month, we get to listen to some of our national experts and what's going on from their observations of activities and events occurring outside of Iowa, as well as their observations of what's occurring in Iowa. So next month, Ellen Condon from Mark Golden Associates will help us dig a little deeper into discovery and what we can do as agencies and systems to incorporate those strategies into some sustainable activities. So Jess, I'm going to turn it over to you for final comments and to mention our survey.
Thank you, David, and thanks again to our presenters today. I just want to draw your attention to the survey questions and ask that you please give us your feedback. We really appreciate it, and we definitely pay attention to that and take all your responses in and help it shape our upcoming webinars and information that we continue to share with you. So thanks again for joining us today, and we look forward to seeing you in June. Thank you, everyone.